Canadians are really proud of our universal healthcare system, and yet mental health falls outside of that system.
A system Margaret Eaton with the Canadian Mental Health Association says needs an overhaul.
69% of people living in Canada believe we're in a mental health crisis, but 82% believe that governments have not responded to do enough about that mental health crisis.
A new survey conducted by the CMHA found 87% of people living in Canada want universal mental health care. Data suggests out of the 35% of Canadians who said they had a mental health concern in the past year, one third did not seek help. Some reasons were because of cost and not knowing where to go. Experts say if you don't have an employer plan or live in a major urban center, accessing support is more challenging, and access to existing programs isn't equal.
While some programs are free, you'll find the waiting lists are incredibly long, like those free programs for children where you have to wait a year and a half.
But the reality is, only about one third of those children actually get the services they need to help them recover.
Underpinning this data is the compounding effect of the COVID-19 pandemic.
When we compared their mental health from before the pandemic to during the pandemic, we saw a notable increase in their depression symptoms and a slight increase in their anxiety symptoms.
Sherry Madigan led a review of data on mental health impacts of the pandemic. She says mental health challenges were more often found in girls and youth from higher income backgrounds. Madigan believes that stems from an abrupt halt to extracurricular activities and greater access to technology, plus girls being more open to discussing their feelings.
Whenever children experience a mental health difficulty in childhood, this places them at greater risk of experiencing mental difficulties in adulthood. So we may see a trickle effect for generations to come.
Catherine Ward, Global News, Toronto.